Earlier this month, we told you the number of people living with chronic pain is overtaking all other major chronic conditions. The top pain complaint is aching back.
And it's a complex condition that often ends up with people having surgery. More operations each year, in fact, than heart bypass or joint replacements. Today, Wink News Health and Medical reporter Amy Osher introduces us to a Naples doctor who offers a unique, even controversial approach that he says offers relief without cutting.
When Dr. Kevin Pauza looked at the epidemic of chronic pain, he worried about both the problem and the solution. Surgery, surgery, and more surgery.
I felt it wasn't in the best interest of the patients. That's why I focused on developing the disc seal procedure.
To understand the procedure, it helps to picture the structure of the spine. It's made up of 24 vertebrae with cushioning discs in between that allow the back to be flexible, with potential trouble spots everywhere. Gregory Paradise was crippled with pain in his cervical spine after breaking his neck years ago.
I was to the point that I felt like I wanted to die, and that's why I decided to seek alternative measures to fix my neck.
He put his pain in Dr. Pauza's hands, opting to try the doctor's disc seal procedure. It's directed at worn, herniated, and ruptured discs. If they're squeezed and lose fluid, it impacts the nerves and can lead to debilitating pain.
The disc is made up of 17 layers, and if those layers tear, it's going to cause the disc to bulge through that layer.
When that happens, there's pain and lots of it. Surgery is the usual solution, a spinal fusion which spaces and stabilizes the vertebrae. A better fix, Dr. Pauza thinks, is to simply seal the disc so it doesn't leak fluid, then allow it to heal. He showed me the two FDA-approved natural biologics he injects while the patient is lightly sedated.
And so these are in our body now, but these are the pure forms. So when I put the one component in, that's already in our body, and then it senses a cut, and it comes to that cut, and I put the second one in, it's almost like a natural epoxy.
And that epoxy stops tears from leaking. You can see it start congealing on contact.
He injected needles down below and got up in the disc.
Dr. Pauza performed the disc seal procedure on Gregory in November.
I felt immediately better.
Then worked on Gregory's wife, Betsy, who had already undergone a 3-level fusion.
I was having a lot of problems. I couldn't walk very well, actually, for about 3 years.
Today, they both say they're pain-free. The disc sealant is applied in minutes, outpatient with no downtime. Maximum results with minimal treatment. Amy Osher, Wink News.